In Nigeria, viral hepatitis seems to be among several diseases that many Nigerians do not know much about. Based on a recent Nigeria HIV/AIDS indicator and impact survey reports, Nigeria has a hepatitis B prevalence of 8.1% and a hepatitis C prevalence of 1.1%. Now, these are indeed daunting figures, as many victims of the disease have not been fortunate enough to have it detected early. In most cases, the disease is diagnosed at a late stage or after it has caused significant damage to the body, especially the liver. As Nigerians join other countries around the world to commemorate 2021 World Hepatitis Day with the theme Hepatitis Can't Wait, how much awareness and funding have been given to hepatitis across the country? Has the disease been somewhat relegated to the background by COVID? Nigeria is also among several African nations that signed to a global health sector strategy target set by the World Health Organization in 2016 to eliminate viral hepatitis as a public health threat by the year 2030. This has been scheduled to run from 2016 to 2021. Now, how has the country fared in this strategy so far? This and other issues will form the basis of this edition of the program, as guests will speak to the topic dealing with hepatitis. Welcome to Nigeria Today. I am Dennis Adigunloye. All right, with me in the studio to discuss dealing with hepatitis is Dr. Homsuk Zwomin. He is a public health physician. Very good to have you on Nigeria Today.
Thank you so much for having me. Good evening.
All right, and also joining us via Zoom is Dr. Mike Omotosho. He is the President, Nigerian Commission Hepatitis Zero representative to the African Union. It's very good to have you join us on Nigeria Today, sir.
Thank you for having me.
All right, I'll come to you very shortly, but let me start with our guest here in the studio, Dr. Homsuk Zwomin. What is viral hepatitis? We've all heard of it, but you are the one in the know. Just give us a breakdown of what viral hepatitis is and its causes.
All right, so for starters, hepatitis is essentially an inflammation of the liver. Mm-hmm. So inflammation basically means a response to injury or assault to the liver. So this injury could come from any means. It could be from toxins, it could be from drugs, it could be from viruses, and that's why we're here. We're talking about viral hepatitis. And it could also be from anything at all, from food you ingest that may be toxic to your liver, and it could also be from medications that one is on. So viral hepatitis is actually a hepatitis that is being caused by viruses. Okay. And currently in the world so far, we have 5 types of viruses that cause hepatitis. We have hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Yeah, so they're all different viruses with different properties, and the way they affect and the way we react to the infection is different. So hepatitis A and E are hepatitis that can easily be spread through poor hygiene practices, and we see most patients get to full recovery after infection, except if there are some co-medical conditions that may affect that. However, hepatitis B, C and D could last to chronic infection. Chronic infection essentially means long-term infection. So essentially that's just what viral hepatitis is.
So basically B, C and D are potentially the most deadly of the...
Yes, the most deadly. Although hepatitis A and E could be deadly depending on who the individual is.
Okay, depending on their immunity and all that.
Yes.
All right, what are the symptoms of these various types of hepatitis, for example?
All right, so for most hepatitis, the symptoms are really non-specific. and it could mimic symptoms of other diseases. However, the things we should usually look out for is tiredness. We call it fatigue. There could be yellowish discoloration of the eyes, as well as the urine as well. There could also be nausea. That's a feeling of, vomiting. There could be vomiting as well, and there could be loose stools. Sometimes when they come to the hospital, they may complain of their stools changing color to be looking like clay. Yeah, and then sometimes they may have abdominal pain. That's a pain in the stomach, most times at the upper right side of the stomach. Those are the symptoms of hepatitis.
All right.
And it could be, a patient may come with all the symptoms. Sometimes it could come with very mild symptoms.
All right. And what are the vulnerable groups? Can we say to
Yes.
these various types of hepatitis?
So
does it target a specific group more than others, or how does the virus work?
So I'm going to break it down because it's dependent on the virus. Yeah. So essentially, for everyone is vulnerable to hepatitis B infection.
Okay.
However, for hepatitis A and E infections, because the route of spread is through poor hygiene, and also through oral routes, mostly people that are in indigent communities, people that have poor immune system, people that live in places that have poor sanitary condition are prone to having hepatitis A and E. And also pregnant women. We have seen pregnant women to be more vulnerable to hepatitis E. In fact, hepatitis E infection in pregnant women, up to 20% could be significant. Yes, because of their status. So those people are more vulnerable. And of course, people in the extremes of age, children and elderly people are at risk of hepatitis B infection. Then for the hepatitis B virus and C virus, people that are injection drug users, people that share needles, people that are having recurrent dialysis, that's exchange of blood, anything that puts you at risk of exposure to blood and blood products. We have also seen reports of people that do acupuncture and tattoo, contracting hepatitis. And of course, because it's shared through blood products and fluid, it can also be transmitted through people practicing unprotected sex. And also people living with other people with hepatitis B, depending on the exposure.
All right, thanks for laying those basic foundations for us. Let me bring our guest who is joining us via Zoom in now, Dr. Mike Omotosho. Dr. Mike, no doubt you've heard a lot of what Dr. Homsuk has said about the different types of hepatitis, the causes, the symptoms, and vulnerable groups. In your opinion, what is the level of awareness among Nigerians as to these different types of hepatitis and how to prevent contracting them? What is your take on that?
Thank you. Let me pick it up from where Dr. Swomin stopped. I totally agree with him. The problem with hepatitis being a silent killer is because it's usually asymptomatic in most cases. You don't even get to see the symptoms. And when you even have the symptoms, they're regular symptoms like you already mentioned: chills, fever, loss of appetite, some pain here or there. In fact, it could even be mistaken for malaria. That's where the problem is. By the time it's beginning to cause some very dangerous damage to the liver, maybe causing by the time you're beginning to see maybe jaundice or edema, it's already gone too far to be remedied, and that's where the problem is. So, like you rightly said, the bulk of the problem now is to get talking about it, and that's why the WHO has aptly titled this year's theme, Hepatitis Can't Wait, because we're barely 9 years to the 2030 SDG declaration to halt the transmission of the hepatitis virus. And what are we doing? Not much. So we need to get talking about it, creating awareness so that more and more people get to know what hepatitis is, get to know that they can truly test themselves. They can that way we can increase the case finding. We can begin to look for catalytic funding. We can begin to look for how we can cascade care across the various sectors of public health. More importantly, for us at Hepatitis Zero, by the way, thank you, Dr. Somen Hamsut, for wearing the vests. I should be wearing the vest too as well. What we do is a mantra that we call Get 3 TV. So what we're simply saying is the first get T is to get talking like we're doing now. Let's keep talking about it. That way more and more people will become aware. They will go to get tested, which is the second T. So you get tested. And then when you get tested, two things can happen. It's either you're positive or you're negative. If you're positive, then you get treated. Fortunately for hepatitis C, there is a full cure. But the B does not have a cure, even though there's a treatment. And if you're lucky enough to be negative, then you quickly get vaccinated. That's the V. So we say get 3 TV. So that way people remember. But for now, let's get talking about it. Most times, all we do is talk about hepatitis on World Hepatitis Day, July 28th, and then nobody talks about it again till the next year. That has to stop. If we truly must halt the transmission of the virus, we must get talking now, and then that way people can get tested, get treated, and then get vaccinated. It will shock you that 1 in 5 Nigerians is walking around with the virus. 1 in 5. And sadly, 4 of those people, 4 of them don't even know their status if you look at it. As much as 80 to 90% of the people having the virus do not even know their status. That's where the problem is. Unlike HIV, that the reverse is the case. We've been about 88% of the HIV cases are already diagnosed. Close to 90% of COVID cases are being picked up. But for hepatitis, where we lose about 4,000 people every year, that comes to about 1 person dying every 30 seconds. To put that in proper perspective, we're talking about 60 people dying in the 30 minutes duration of this program due to an ailment that has a vaccine, an ailment that has a treatment, an ailment that can result in cure in certain cases. It is totally unacceptable, and truly, hepatitis can't wait.
Definitely. All right, staying with you, Dr. Mike, COVID-19 has been with us and potentially can be with us for the foreseeable future. How has the global fight against COVID, how has it affected awareness campaigns and the challenge that is hepatitis, and moving forward in terms of minimizing its impact on global health?
Oh, incidentally, it's helping to spotlight health generally. And luckily, ailments like hepatitis are beginning to get a bit of mention. For instance, we're already partnering with the WHO to have an expanded pilot done where you can actually have hepatitis screening done alongside COVID screening. And it's been done already in Brazil successfully. So it's been expanded to Nigeria, Mexico, and 1 other European country. Once the pilot stage goes through, then it's going to be expanded all through, because by the time you prevent yourself from contracting the hepatitis virus, that's 1 ailment less to bother about. So yes, it's a blessing in disguise. We're not excited that COVID is here, but hey, it's here. We've got to live with it, and we're making the best use of the opportunity that it provides.
All right, thanks for that, Dr. Mike. We'll certainly get back to you shortly. We are going to take a quick break now. The program is Nigeria Today. Do stay with us. We'll be back. Let's now hear from the Director General of the WHO in person of Dr. Tedros Ghebreyesus.
There are 5 main strains of the hepatitis virus. The 2 most common types, B and C, cause liver damage and liver cancer. An estimated 325 million people globally live with hepatitis B or C. And each year, these viruses kill an estimated 1.3 million people. One of the most significant challenges we face in eliminating hepatitis B is mother-to-children transmission. We call on countries, especially those with highest burden, to implement these new guidelines as an important stepping stone on the road to hepatitis elimination.
All right, you're welcome back. The program is Nigeria Today. We are discussing dealing with hepatitis. We have Dr. Homsuk Swomin, public health physician, here with us in the studio, and via Zoom, Dr. Mike Omotosho, President, Nigerian Commission Hepatitis Zero representative to the African Union. We just heard from the DG of the World Health Organization, Dr. Tedros Ghebreyesus. Dr. Homsuk, give us your take on some of those startling figures that you churned out there.
Yeah, I think I'll take off from where Dr. Omotosho stopped. Yeah, the figures are alarming. And in fact, if you look at the disaggregated data by some countries, hepatitis alone accounts for more deaths than HIV, TB, and malaria combined. Yeah, so it's quite significant. And it's here with us. We're just coming from the field in a community called Kuchingoro, where we had a community outreach. That's the Rotary Club of Abuja, Jabi Lakeside. And out of over 100 people that we tested, we had a significant yield. Yes. And to be honest, some of those people never heard of hepatitis. So I think the first T...
Never heard of it, and they're carrying it. Wow.
So the first T that Dr. Omotosho talked about, we need to keep talking. And of course, we need to keep talking in appropriate languages. And language that the people will understand, okay? Because some of the times our messages may be skewed in a way. We could use a different language, but we really need to go to the communities and speak to them in the way they understand. And COVID as well, on the flip side, has revealed global inequalities, isn't it? Even in healthcare access. And there's a risk of the health system gravitating towards COVID response and then hepatitis B suffering. So we need to keep our antennas high to know that, there are some other conditions that could be suffering because of COVID response, so we need to work on it.
All right, and in terms of testing for these various types of hepatitis, what can the general public do? Someone who might want to know what their status is like with HIV testing, what's the procedures?
So testing, I just want to tell the public that testing is quite easy and straightforward. Thankfully for science, we have very rapid test kits that are available that check your antibody levels of hepatitis B or any form of hepatitis B, C test. So these tests are readily available and they are quite affordable as well. As much as we try to make testing available through campaigns, through government support, through antenatal clinics and other programs like the Maternal and Newborn Child Week, also the Integrated Medical Outreach Plans called the IMOP in a lot of states. Anyone that wants to know his or her status can just walk into some medical stores, some pharmaceutical stores, and even walk to any hospital and say you want to have a hepatitis B test, and it's readily available. You can have it. We just take a small a drop of your blood, which is like a drop of blood in an ocean, so you don't need to worry about that. And then within minutes your results will be ready. And then of course you would have counseling on where you can go for help. Because during our campaign today, all the clients that tested positive, we were able to direct them to specific places that they could get help.
And in terms of physical treatments for these certain types of hepatitis, what does that entail?
Yes, so the treatment for hepatitis A and hepatitis E is basically supportive. Yeah, based on the symptoms that the patient may present with. Most times, as Dr. Motoshaw said, they don't really know that they have hepatitis until something happens and then they come to the hospital. However, for hepatitis B and C, as he mentioned, hepatitis C treatment is readily available and we can achieve cure. However, it could be expensive and really pricey. Hepatitis B treatment, depending on the stage of the infection and how the patient presents, there are medications that can be supportive and there are medications that we are currently using that are really helpful. So essentially we encourage people to go for testing, and where the result is positive, try to be in care. A lot of people just get the test and then they want to go for second opinion and they want to go to this center and the other center and all that. It's fine. But once a medical practitioner tells you that this is the result, just try and be in care in a center that has a specialist that deals with that. Because once you're in care, you'll be able to be managed through serial investigations and medications, and then you will be tracked over time to see how you're improving.
All right. Okay, let me come back to Dr. Mike. Dr. Mike, back in 2016, Nigeria signed to a global health sector strategy towards elimination of hepatitis. How, in your opinion, has the country, Nigeria, fared in the execution of this strategy?
Wow. That's a very tough nut to crack. Because like with so many other things, we're truly not on track and we've got to tell ourselves the truth. Fortunately, I'll say fortunately, Nigeria is not alone. Only 6 countries are on track towards meeting this global target of halting the transmission of the virus by the year 2030. And of course, like you already guessed, Nigeria is not one of those 6. So we have a lot of countries in this bad gang, so to say. But all hope is not lost. We're happy that the Federal Ministry of Health is coming on strongly to partner with all civil society organizations. We also have a strong relationship with the National Orientation Agency to get the words out there. Some other donor agencies like the Clinton Health Access Initiative and even business entities like Philips Pharmaceuticals are also coming on board to be a part of this. What we really need is the support of the media, because by the time more and more people get to know about hepatitis, then more and more people will get themselves screened, and once you get to know your status, you get to know if you should take the vaccine or go for treatment. And the beautiful part is the B actually has a vaccine, and that vaccine will be taken 1 month apart in 3 doses. And that's it. And you're protected for 10, 20, 30, or even for life, depending on the manufacturer of the vaccine. So if you're able to know your status on time, then you can be protected. Unfortunately, the C does not have a vaccine, but it is very curable, even though it's expensive. But I often tell people, by the time you know your status and you're free, then you can be more cautious and advise others on what to do. We also have pharmacy stores that are partnering with us. They do these vaccines, these screenings free of charge.
Very briefly, please,
in and around the country.
Just round up your comments just very briefly in the last 20 seconds. Our time is up. I'm hearing from my director. Just conclude your remarks.
I didn't hear you.
Just conclude your remarks very briefly, please. Our time is up.
Oh, okay. So we're calling on all well-meaning Nigerians to join this fight against hepatitis. We truly can do it. We need to understand that it's a silent killer, so people should get talking about it. Then go get tested, get treatment if you're positive, and get vaccinated if you're negative. It is curable, and there's no need for people to keep dying for an ailment that has a vaccine and can be treated.
Absolutely. The battle can be won against hepatitis. Dr. Mike Omotosho, President, Nigeria Commission, Hepatitis Zero representative to the African Union. Many thanks for taking the time to be with us on Nigeria Today and sharing your expertise with us. Thank you. And thanks also to Dr. Hamsuk Swamans, public health physician. Many thanks for your
Thanks
time
for
and
having
your
me. Thanks.
expertise as well.
Yeah,
Thank you. And thanks to you out there for watching. Nigeria Today is live every weekday at 7:30 in the evening. Also catch this and other editions of the program on youtube.com/NTA News 24 Hub. I'm Dennis Adigundoye. Thanks for your company.